What is the Code of Conduct? 3 Principle 15 Principle 26 Principle 38 Principle 4. What is the Code of Conduct? The College of Nurses of Ontario, CNO, protects the public by promoting safe nursing practice. One way we do this is by developing standards of practice for all nurses in Ontario. The Code of Conduct, CODE, is a practice standard describing the accountabilities all nurses registered in Ontario have to clients, employers, colleagues, and the public. It explains what people can expect from nurses. The code also describes what nurses must do to maintain professionalism, competence and ethical behavior to deliver safe client care. All nurses, registered practical nurses, and nurse practitioners, are expected to uphold this practice standard, regardless of their role, title, or responsibility. To maintain public trust and confidence in the nursing profession's integrity and care, the Code outlines safe and ethical practice requirements based on current evidence. The Code is also informed by legislation, such as the Ontario Human Rights Code and recommendations in the Truth and Reconciliation Commission of Canada, Calls to Action, 2015. The Code puts clients at the center of nursing care and includes principles of diversity, equity, and inclusion to ensure client care is safe, compassionate, equitable and discrimination-free. Throughout the Code, we use the word client broadly, to include individuals, substitute decision-makers, families, caregivers, groups, communities, and populations who receive nursing care. Nurses are expected to use the Code along with other CNO practice standards. The Code applies to any method a nurse uses to deliver healthcare services, such as in person, virtually or by telephone. CNO considers the Code in regulatory processes and in reviewing the practice of nurses such as in quality assurance and professional conduct processes. Nursing practice is considered in its working context and circumstances. The 2019 version of this document was adapted with the permission of the Nursing Council of New Zealand from the Council's Code of Conduct for Nurses, 2012. This document is a substantial revision of the previous adaptation. A glossary of bolded terms is provided at the end of this document. Principles of the Code. The Code consists of 6 principles. 1. Nurses respect clients' dignity. 2. Nurses provide inclusive and culturally safe care by practicing cultural humility. 3. Nurses provide safe and competent care. 4. Nurses work respectfully with the healthcare team. 5. Nurses act with integrity in clients' best interest. 6. Nurses maintain public confidence in the nursing profession. Each principle is supported by a set of statements of core behaviors all nurses are accountable for. All principles have equal importance and work together to describe the conduct, behavior, and professionalism necessary for safe and ethical nursing practice in Ontario. Nurses respect clients' dignity. In this principle, nurses work together with clients with respect and sensitivity to client needs. To do this, nurses are expected to model the following core behaviors. 1.1 Nurses treat clients with respect, empathy, and compassion. 1.2 Nurses prioritize clients' health and well-being in the therapeutic nurse-client relationship. 1.3 Nurses act in clients' best interests by respecting their care preferences, choices, and decisions. 1.4 Nurses respect clients' rights and involve and support clients in making care decisions. 1.5 Nurses listen and respond to clients' concerns by collaborating with clients and any person or community the client wants involved in their care. 1.6 Nurses maintain clients' privacy and dignity, regardless of where the client receives care or of its mode of delivery. This includes after the nurse-client relationship ends. 1.7 Nurses communicate to clients, clearly and timely, the care details they propose to offer. 1.8 Nurses obtain informed consent from clients, or from their substitute decision-makers when clients are unable to do so, as set out in CNO's Consent Guideline and the Healthcare Consent Act, 1996. 1.9 Nurses identify when their own personal beliefs conflict with a client's care plan, and provide safe, compassionate, and timely care to those clients, until other arrangements are in place. Nurses provide inclusive and culturally safe care by practicing cultural humility. In this principle, nurses demonstrate cultural humility through self-reflection and evaluating their own behavior. They advocate for equitable and culturally safe care that is free from discrimination. This includes understanding how personal attributes and societal contexts, such as disabilities, sexual identity, anti-Indigenous and anti-Black racism, influence client care. To achieve this principle, nurses are expected to model the following core behaviors. Self-reflection. 2.1 Nurses self-reflect on and identify how their privileges, biases, values, belief structures, behaviors and positions of power may impact the therapeutic nurse-client relationship. 2.2 Nurses do not act on any stereotypes or assumptions they may have about clients. 2.3 Nurses seek feedback from clients, the healthcare team, and others to evaluate their own behavior and culturally safe practice. Creating safer healthcare experiences. 2.4 Nurses recognize that many identity factors and personal attributes, including those identified in the Ontario Human Rights Code, may impact a client, their lived experience and perspective on healthcare. Continued. 2.5 Nurses assess and strive to meet clients' language, cultural and communication needs in ways clients understand. 2.6 Nurses ask clients if they are open to sharing their lived experiences. 2.7 Nurses address clients by their preferred name, title, and pronoun. 2.8 Nurses actively listen to and seek to understand the client's lived experiences. 2.9 Nurses assess clients to determine their risk for health inequities and take steps to ensure the best client outcomes. 2.10 Nurses give care that focuses on clients' resilience and strengths. Nurses work with clients to achieve their health and wellness goals. 2.11 Nurses take proper action to prevent discrimination and when they observe or identify discrimination against a client. 2.12 Nurses participate and advocate for culturally safe and inclusive practice environments. Training and education. 2.13 Nurses continually seek to improve their ability to provide clients culturally safe care. 2.14 Nurses undertake continuous education in many areas, including Indigenous healthcare, determinants of health, cultural safety, cultural humility, and anti-racism. Parts of Principle 2 have been adapted with permission from BCCNM's Indigenous Cultural Safety, Cultural Humility, and Anti-Racism Practice Standard, British Columbia College of Nurses and Midwives, 2022. Nurses provide safe and competent care. In this principle, nurses work within the limits of their legal scope of practice, education, experience, knowledge, skill, and judgment to ensure safe and competent nursing care. To do this, nurses are expected to model the following core behaviors. 3.1 Nurses identify themselves to clients consistent with CNO's public register, using their name, title, RN, RPN, NP, and their role within the healthcare team. 3.2 Nurses recognize and work within the limits of their legal scope of practice and their knowledge, skill, and judgment. 3.3 Nurses identify when clients' therapeutic needs are outside of their legal scope of practice or individual competence and support clients to seek services from the proper healthcare professionals. 3.4 Nurses seek and use the best available evidence to inform their practice. 3.5 Nurses conduct research ethically, including placing client well-being above all other research objectives. 3.6 Nurses use their knowledge, skill, and judgment when giving nursing care. Nurses modify client care plans, together with clients and the healthcare team. 3.7 Nurses respond and are available to clients in their care. Continued. 3.8 Nurses give timely nursing care. When timely care is not possible, nurses explain to clients the reasons for delay and take steps to avoid or limit client harm. 3.9 Nurses advocate for and support clients in accessing timely health care that meets clients' needs. 3.10 Nurses are accountable for engaging in safe medication practices as set out in CNO's Medication Practice Standard, including having proper legal authority and requisite knowledge, skill, and judgment. 3.11 Nurses are accountable for maintaining and keeping clear, complete, accurate, and timely documentation as set out in CNO's Documentation Practice Standard. Nurses do not document false or misleading information. 3.12 Nurses in independent practice conduct appropriate business practices as set out in CNO's Independent Practice Guideline, including accurate record keeping, informing clients of fee components and charging fitting and reasonable fees. 3.13 Nurses discontinue nursing services if the client requests it as set out in CNO's Discontinuing or Declining to Provide Care Practice Standard. Nurses arrange timely alternative or replacement services or provide clients a reasonable opportunity to arrange alternative services. Nurses work respectfully with the healthcare team to best meet clients' needs. In this principle, nurses are accountable to one another and are expected to build and maintain respectful relationships with the healthcare team. To do this, nurses are expected to model the following core behaviors. 4.1 Nurses self-reflect on how their privileges, biases, values, belief structures, behaviors and positions of power may impact relationships with healthcare team members. 4.2 Nurses identify and do not act on any stereotypes or assumptions they may have about healthcare team members. 4.3 Nurses address healthcare team members by their preferred name, title, and pronoun. 4.4 Nurses recognize many identity factors and personal attributes, including those identified in the Ontario Human Rights Code, may impact a healthcare team member, their lived experience and perspective on nursing and healthcare. 4.5 Nurses demonstrate professionalism and treat all healthcare team members with respect in all contexts, including on social media. 4.6 Nurses collaborate and communicate with the healthcare team in a clear, effective, professional, and timely way to provide safe client care. Continued. 4.7 Nurses do not physically, verbally, emotionally, financially, or sexually harass or abuse healthcare team members. 4.8 Nurses support, mentor, and teach healthcare team members. 4.9 Nurses assess the learning needs of healthcare team members they are teaching, supervising and/or assigning. Nurses determine whether individuals have the proper knowledge, skill, and judgment to perform safe nursing care. 4.10 Nurses delegate nursing care so it upholds the expectations outlined in the Nursing Act, 1991 and set out in CNO's Scope of Practice Standard. Nurses do not direct healthcare team members to perform nursing care they are not adequately educated for or competent to perform. 4.11 Nurses provide and accept feedback from the healthcare team to support positive client outcomes and effective team performance. 4.12 Nurses contribute to a safe organizational culture. Nurses act with integrity in clients' best interest. In this principle, nurses are honest and fair practitioners who strive to build a trustworthy, therapeutic, nurse-client relationship. To do this, nurses are expected to model the following core behaviors. 5.1 Nurses fairly divide and advocate for resources. Nurses objectively arrange care, based on health-related needs. 5.2 Nurses protect the privacy and confidentiality of clients' personal health information as set out in CNO's Confidentiality and Privacy, Personal Health Information Practice Standard and the Personal Health Information Protection Act, 2004. 5.3 Nurses do not share clients' personal health information, unless for therapeutic reasons and only in compliance with laws and standards of practice governing privacy and confidentiality. 5.4 Nurses do not act as attorneys for personal care or as substitute decision-makers for their clients in accordance with the Healthcare Consent Act, 1996. 5.5 Nurses identify, prevent, and do not practice in situations that cause a conflict of interest. If a conflict of interest exists or arises at any point during the therapeutic nurse-client relationship, nurses explore alternative services with clients. 5.6 Nurses place their professional responsibilities ahead of their personal gain. 5.7 Nurses initiate, establish, and maintain professional boundaries with clients and terminate the nurse-client relationship as set out in CNO's Therapeutic Nurse-Client Relationship Practice Standard. Continued. 5.8 Nurses do not physically, verbally, emotionally, financially, or sexually abuse, harass or neglect their clients as set out in CNO's Therapeutic Nurse-Client Relationship Practice Standard and the Regulated Health Professions Act, 1991. 5.9 Nurses strive to protect clients from any type of harm, neglect, or abuse. This includes taking action to stop and refrain from unsafe, incompetent, unethical, or unlawful practice. 5.10 Nurses are truthful in their professional practice. 5.11 Nurses identify moral or ethical situations and proactively address conflict, dilemmas, and/or distress of clients in their care. 5.12 Nurses promote healthy relationships with clients, their caregivers, advocates, and members of the healthcare team by managing and resolving conflict for best client care. Nurses maintain public confidence in the nursing profession. In this principle, nurses promote dignity and respect for the nursing profession by portraying professionalism and showing leadership. To do this, nurses are expected to model the following core behaviors. 6.1 Nurses understand and practice in compliance with relevant laws and standards of practice and do not breach them. 6.2 Nurses are accountable for their own decisions, actions, omissions, and related outcomes. 6.3 Nurses take accountability for their errors and learn from them. 6.4 Nurses report any error, unsafe behavior, unethical conduct, or system issue to relevant individuals, including employers, CNO and other regulatory colleges, whether or not harm has occurred. 6.5 Nurses participate and advocate for improving the quality of their practice setting to support safe client care. 6.6 Nurses do not steal, misuse, abuse or destroy the property of their clients, healthcare team or employers. 6.7 Nurses self-reflect on health and seek help if their health affects their ability to practice safely. Continued. 6.8 Nurses do not practice when impaired by any substance. 6.9 Nurses self-reflect, identify learning needs in their practice and engage in continuous learning to improve their competence. 6.10 Nurses participate in and keep records of their participation in CNO's Quality Assurance Program. 6.11 Nurses do not publicly communicate healthcare statements that contradict the best available evidence. 6.12 Nurses do not engage in any acts of professional misconduct or incompetence. 6.13 Nurses cooperate with CNO, including cooperation in investigations and offering complete and accurate information. Appropriate business practices, reasonable actions that nurses in independent practice carry out for client safety. This includes, but is not limited to, record keeping, setting reasonable fees, getting professional liability protection, using accurate advertising and developing proper staffing policies. Boundaries, the points when a relationship changes from professional and therapeutic to unprofessional and personal. Therapeutic nurse-client relationships put clients' needs first. Crossing a boundary means a nurse is misusing their power and trust in the relationship to meet personal needs or is behaving in an unprofessional manner with the client. Crossing a boundary can be intentional or unintentional. See CNO's Therapeutic Nurse-Client Relationship Practice Standard. Client, an individual, family, group, community or population receiving nursing care, including, but not limited to, patients or residents. Conflict of interest, when a nurse's personal interests improperly influence their professional judgment or conflict with their duty to act in client's best interest. This includes financial and non-financial benefit, whether direct or indirect. Cultural humility, an unending process where healthcare providers engage in self-reflection and self-critique to minimize power differentials between them and their clients. It helps clinicians build skills to understand a client's cultural context through the client's perspective and emphasizes the importance and value of others' perspectives and cultures. CNO et al., 2021, Verkstes et al., 2021. Cultural safety, effective client care by a healthcare provider who has undertaken a process of reflection on their own cultural identity and recognizes the impact of their own culture on their practice. It addresses issues of inequality rooted in historical and structural violence and discrimination leading to power differences and imbalances. Instead, it focuses on safe systems, clinical settings, and interactions. McGuff et al., 2022, with L et al., 2021. Determinants of health, the broad range of personal, social, economic, and environmental factors determining individual and population health. The main determinants of health include income and social status, employment and working conditions, education and literacy, childhood experiences, physical environments, social supports and coping skills, healthy behaviors, access to health services, biology and genetic endowment, gender, culture or race/racism, Government of Canada, 2022. Documentation, health records, which may be in a variety of forms, for example, paper, electronic, audio, used to reflect the client's needs or goals, the nurse's inactions, actions, and decisions, communication with other healthcare providers and the outcomes and evaluation of those inactions, actions, or decisions. Healthcare team, members of the intraprofessional and/or interprofessional team and/or community supporting client care. This also includes students, new learners, indigenous and traditional healers. Health inequities, differences in health status or in the distribution of health resources among different population groups, arising from the social conditions in which people are born, grow, live, work and age. World Health Organization, 2018. Independent practice, nurses in independent practice are self-employed, for example, operating their own economic enterprise, for the purposes of offering nursing services and/or operating their own nursing business. Informed consent, as described under the Healthcare Consent Act, a person's consent is informed if the person receives information about a treatment that a reasonable person in the same circumstances would require to make a decision and if the person receives responses to their requests for additional information about the treatment. The information must include the treatment's nature, expected benefits, material risks and side effects, alternative courses of action, and likely consequences of not having the treatment. Medication practices, client-centered practices of the most safe and effective medication therapy. Practices may include but are not limited to the following activities: administration, prescribing, dispensing, medication storage, inventory management and disposal of medications. Nursing care given to a client, which includes, but is not limited to, assessment, planning, delivery, monitoring, evaluation and care coordination. Personal attributes, qualities or characteristics unique to a person. As reflected in the Ontario Human Rights Code, this includes citizenship, race, place of origin, ethnic origin, color, ancestry, disability, age, creed, sex/pregnancy, family status, marital status, sexual orientation, gender identity, gender expression, receipt of public assistance, in housing, and record of offenses, in employment. Personal attributes also include political affiliation, income, and social status. Personal gain, advantage or benefit, financial or otherwise, a nurse receives. A personal gain can be monetary, cash, gifts, or rewards, or give the nurse other personal advantages. A personal gain includes the nurse's family's interests, charitable causes, or organizations the nurse supports. It does not include a nurse's salary or benefits. Personal health information, as reflected in the Personal Health Information Protection Act, 2004, including any identifying information about clients' physical or mental health or their family's health history. Quality Assurance Program, a CNO program in which nurses demonstrate their commitment to continuing competence and quality improvement of their knowledge, skill, and judgment through assessing themselves, their practice and peers. CNO's Quality Assurance Program is mandated by the Regulated Health Professions Act, 1991. Report: the legal and organizational requirement to disclose safety issues related to healthcare professionals' individual practice, or issues impacting practice settings. Examples of legal reporting requirements include reporting to proper authorities any healthcare team member whose actions or behaviors toward clients are unsafe or unprofessional according to applicable legislation, including, but not limited to, the Fixing Long-Term Care Homes Act, 2021, Child, Youth and Family Services Act, 2017 and the Public Hospitals Act, 1990. Another example is reporting a regulated health professional's sexual abuse of a client to the registrar of the proper regulatory college according to the Regulated Health Professions Act, 1991. An example of an organizational reporting requirement is reporting medication near misses. Resilience: the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, or behavioral flexibility and adjustment to external and internal demands. Some factors contribute to how well people adapt to adversities, predominant among them: the ways individuals view and engage with the world, the availability and quality of social resources, specific coping strategies, APA Dictionary of Psychology, ND. Self-reflection, an intentional and continuous process nurses engage in to critically think about their practice. Reflecting on practice daily helps nurses identify strengths and any learning needs. See CNO's Quality Assurance Program for more information. Scope of practice: the expectations and limitations of nurses' duties and responsibilities. Nurses are legislated, educated, and authorized to perform roles, responsibilities and functions, as reflected in the controlled acts authorized to nurses in the Regulated Health Professions Act, 1991 and in Section 3 and 4 of the Nursing Act, 1991, and those acts' regulations. The scope of practice is further defined in Section 3 of the Nursing Act, 1991. The practice of nursing is the promotion of health and assessment of, the provision of, care for, and the treatment of health conditions by supportive, preventive, therapeutic, palliative, and rehabilitative means in order to attain or maintain optimal function. Social media, community-based online communication tools, websites and applications, used for interaction, content sharing, and collaboration. Types of social media include blogs or microblogs, personal, professional, or anonymous, discussion forums, message boards, social networking sites and content sharing websites. Standards of practice, expectations for how a competent nurse should perform. Standards of practice describe nurses' expected behavior and contribute to public protection. Substitute decision maker, person, identified by the Healthcare Consent Act, 1996, who makes a treatment decision for someone who cannot make their own decision. See CNO's consent guideline for more information. Therapeutic nurse-client relationship, a professional relationship between a nurse and a client, which focuses on meeting the client's health needs. There are 5 components to the nurse-client relationship: trust, respect, professional intimacy, empathy, and power. Truthfulness, speaking or acting without intending to deceive. Truthfulness also refers to giving accurate information. Intentional omissions are as untruthful as false information. American Psychological Association. ND. Resilience. In APA Dictionary of Psychology. Retrieved 2022 from British Columbia College of Nurses and Midwives. 2022, Indigenous Cultural Safety, Cultural Humility, and Anti-Racism Practice Standard. Safety Humility/all PS Cultural Safety Humility.pdf. College of Nurses of Ontario. 2025, Code of Conduct. PRC/49040 Code of Conduct.pdf. College of Nurses of Ontario. 2025, Confidentiality and Privacy, Personal Health Information. Privacy.pdf College of Nurses of Ontario. 2025, Consent. Consent.pdf College of Nurses of Ontario. 2025, Documentation, revised 2018. Global Assets /docs/pric/41001 Documentation.pdf. College of Nurses of Ontario. 2025, Independent Practice. pric/41011 fsindepric.pdf. College of Nurses of Ontario. 2025, Medication. pric/41007 medication.pdf. College of Nurses of Ontario. 2025, Therapeutic Nurse-Client Relationship, revised 2006. Fixing Long-Term Care Homes Act, 2021, so 2021, C39. Government of Canada. 2022, November 22. Determinants of Health. https://www.150.statcan. gc.ca/n1/pub/82-570-x/20230001/section4-ang.htm. Healthcare Consent Act, 1996, SO 1996, C2. Human Rights Code, RSO 1990, CH19. Statute/90H19. Search equals Ontario plus Human plus Rights plus Code. McGuff, S. Wynaden, D. Gower, S. Duggan, R. and Wilson, R. 2022. There is no health without cultural safety. Why cultural safety matters. Contemporary Nurse, a journal for the Australian nursing profession, 58, 1, 33-42. 7254 Nursing Act, 1991, so 1991, C32. Personal Health Information Protection Act, 2004, so 2004, C3. Statute/04P03. Search equals Personal plus Health plus Information plus Privacy plus Act. Public Hospitals Act, RSO 1990, CP.40. Statute/90P40. Search equals Public plus Hospitals plus Act. Regulated Health Professions Act, 1991, so 1991, C18. Statute/91R18. Search equals Regulated plus Health plus Professions plus Act. Verkstes, K. Whitemarsh, K. Ruers, L. and Payawansky, A. 2021. A four-part strategy to engage frontline nurses in cultural humility. Jonah, The Journal of Nursing Administration, 51, 12, 597-599. With L. Ryder, C. Mackian, T. Edmondson, W. Schoberg, D. McDermott, D. and Wilson, A. 2021. Assessing Cultural Safety in Aboriginal and Torres Strait Islander Health. Australian Journal of Rural Health, 29, 201-210. World Health Organization. 2018, February. Health Inequities and Their Causes. Zenan, N. 2021. Humility in Healthcare, a Model. Nursing Philosophy, 22, 3, 1-8. Code of Conduct. Practice Standard. College of Nurses of Ontario 101, Davenport Road, Toronto, on M5R3P1. CNO@cnomail.org. 416-928-0900 toll free in Canada 1-800-387-5526.